Hi, I'm Suzanne Watley with a news tip. Have you gotten your flu vaccine yet? You know it's not too late. We are seeing the deadly impact of this very serious disease because in December we had the first flu death of the season. It was a Kern County man and he was only in his late 30s. This is a reminder of not just the fact that babies and the elderly are at risk of dying of the flu, but it could happen to anyone, particularly at risk pregnant women and people with chronic illnesses who have a suppressed immune system. Now, the seasonal flu vaccine should be available at your doctor's office. It's also widely distributed at pharmacies and available to walk-in customers. The seasonal flu vaccine is the sort of thing that anybody can receive, but it's particularly recommended for that high-risk group. Also, there is a nasal spray that's available to healthy people who are not pregnant between the ages of 2 and 49. Take heart in the fact that researchers are looking into ways to get the body's immune system to recognize what is the same about this constantly mutating virus, go after that and attack that aspect of the flu virus. So the goal is to have the same vaccine last you year after year. My name is Suzanne Watley, and that's my news tip.
I've been golfing for years. Golf is not just recreation for me, it's part of doing business. Lately, my swing keeps slowing me down, and the pain in my hip is making me feel old. So I went to see an orthopedic surgeon at Glendale Adventist Medical Center. I found that I needed hip replacement surgery and was pleased that they offered a minimally invasive approach. I was back at work within a week, and my swing is better than ever. Thanks to Glendale Adventist, I'm back in the game.
Welcome back to HEALTHline. Tonight we're in the conversation of home health care. And before the break, Diane Brown, registered nurse from Glendale Adventist Medical Center, was sharing with us what we need to know in regards to what patients need at home in regards to home health care. Diane, you were talking about if you're diabetic, what kind of food and medications. Do you incorporate the family to all of this as well?
Definitely. That's a big part of what we do. Is we teach the family how to take care of their family member that's sick. We teach them all about medications and signs to look for complications. And we definitely incorporate the family a lot in what we do. Can family,
because you talked about maybe you were addressing diabetes and diabetics and insulin checking stuff. Can family members draw blood and take blood and administer medications that way as well upon you teaching them?
Right, we teach them how to check their blood sugar with the machine.
Okay.
So yeah, definitely they learn how to do that, and then the patient can learn too if they're able.
But they can't draw their own blood or anything unless they're
we would send a nurse out to take the blood specimen and get the test that the doctor would need. But that's another service that we provide, so the doctor can still be monitoring how the patient's doing in the home, as opposed to going to the doctor's office or going to the hospital. We can do that piece for the doctor and for the patient.
Oh, that's fantastic.
Yeah. Most patients would probably rather, if they could be, at home instead of at the hospital.
And getting better.
It's less expensive and it's more comfortable and they're in more familiar surroundings.
And it's also easier for the family member instead of taking the family member to the doctors back and forth, so on and so forth.
And we do take care of patients that it's very complicated for them to leave the home. So we can be the eyes and the ears for the doctor to manage that case in the home, and then they could see the doctor periodically, because it does take the doctor being very involved with us and the patient to provide the best care. But it can be very difficult for some patients to actually get out of the home.
So then you report back to the doctor, or per se to Wendy. You go through all the files. You then see what's going on, and then you report back to the doctor, and then they give you the prescription as to what they need. Oh, great!
Diane, I'm interested in what inspired you to want to do this for a living.
Oh well, you know, I always wanted to go in some sort of field of helping, and I was planning to be a social worker at one time, but then I decided that really wasn't what I wanted to do. So I just happened actually just to stumble upon nursing, and I'm glad I did. It's really a great field. There's a lot of flexibility.
And what do you like about doing the nursing in people's homes?
You know, you really get to know the patient in their home. I mean, in the hospital, you see it just a certain part of the patient, but once you go into their home,
you're in their world.
You're in their world. I mean, you meet their family. You see how they live. How they eat. everything, you know. It's like you said, it's their world, and you really get to know them on a different level.
We have such a diverse population in
do.
Glendale. I imagine there's different language and cultural needs that your department needs to be able to meet.
Right, we have a very diverse staff.
How many languages does your staff speak?
Probably about 5 different languages. And also being part of the hospital system, if there's an issue with the language that not a language that our staff represents, we have a system in place that we can get the right person to the home, so there won't be a barrier with the language. So
then language, because in the past language has always been a question. Like, oh, do they speak our language? But since we're so culturally diverse here.
Right. So we can meet the language need that the patient has.
That's great.
And again, being hospital-based, Adventist Health, hospital-based agency, in conjunction with Glendale Adventist, we have those services and those capabilities that some of the other agencies don't have. And language is one area that we have it covered based on the language line and the availability of that special service to meet the patient's needs.
There's a lot of different home care choices that people could make here in the Southern California area, but we'll talk a little bit more about the advantages of affiliating with a home care service that's connected with a hospital when we come back here on HEALTHline.
Hi, I'm Diane. I'm from Adventist Health Home Care Services, and I'm here to tell you about some of our services that we offer. Do you need assistance with your medications? Do you have problems with remembering when to take them, what they're for? Do you have wounds that you need help with? Are you a diabetic? Do you have any health concerns that we can help you with? We also offer therapy services for home evaluations to make sure you're safe in your home. For a list of our services or any other way we can help you, please give us a call at 818-409-8379 or visit our website.
Well, here's a question. What if you needed health care at home? You could put an ad in the newspaper or on Craigslist. You could solicit resumes. You could review them. You could hire somebody individually and pay them and pay their payroll tax and all this sort of stuff that really is very complicated, actually. Or you could go to an agency which has licensed and screened professionals who do that for you, and they take care of all the paperwork and the scheduling and everything else. We are talking with 3 ladies who are affiliated with just such a service, which is associated with Glendale Adventist Medical Center. It's Adventist Health Home Care, and we're so pleased to have you here. The director, Wende Brookshire, we were talking in the previous segment about one of the main advantages of your agency being affiliated with Glendale Adventist, and that's you've got all the different languages that are spoken in the greater Glendale area represented there at the hospital. What are some of the other advantages to selecting a service that's affiliated with a hospital?
Well, again, just what you mentioned about being affiliated with Glendale, we have a very large service area. We 30-mile radius where we're going to Santa Clarita Valley. We're going.
You go that far out?
Yeah, 605 freeway south to the 105 freeway, north up through Valencia. So we have a very large service area because patients come from everywhere to come to Glendale Adventist Medical Center, so we can meet their home care needs
once they get discharged.
Once they get discharged, because we have such a large service area. But one of the other advantages of our home care agency versus some of the other home care agencies, all our staff is screened. They go through a health clearance. Just like you said, we pay for personal home care. For the private duty piece, we pay their taxes. We are the employee. It's not the individual homeowner. So the liability is really on us. We make sure they have up-to-date training. We make sure they continue on their health screening, their health needs also, because you want to have healthy staff. When you hire somebody on the outside, you don't know that those screens and those measures have been put in place.
Especially when you find them on Craigslist.
Exactly. You don't know what the background is.
Craigslist. We're so good on that.
I guess, really.
So then outside of what Diane was talking about in regards to maybe drawing blood and, of course, medications, what other services do you offer?
I think another big part of our service, since we have a lot of elderly patients, is managing the safety in their home. Frequently our patients have been in the hospital, they're discharged, and they're going back to their home environment. And we take a look at physical therapists or experts in managing their home environment, checking for home safety issues.
Like rugs and things that they could trip on and fall on, and make sure that their paths are safe.
Making sure their paths are safe, making sure their furniture is at the right height, So it's easier for them to sit down and be able to get back up, looking at the bathroom to make sure that there's not special equipment, so they can bathe safely and independently. We want patients to be independent. So physical therapy will evaluate the patient, put them on a home exercise program, just to make sure they stay safe and strong in their home.
What if, like, my elderly parent needs handrails and special, like, no-skid things on the steps and this sort of thing? Can you provide that service too?
We can certainly make an assessment and provide the correct resources. So those pieces of equipment can be placed in the home, whether it's attaching to the wall or the strips in the bathtub, special like wheelchairs or walkers or special equipment. So we make sure that that's covered, whether we're doing it or providing another service with another entity.
Well, full service, and it all goes back to the mission of the hospital, which is
exactly
personal care and God's love. When we come back, more on home health care, and if you or someone you love needs these services, we're going to tell you exactly where you're going to go to find it, so do not go away.